Welcome everyone to our last health equity webinar of 2023. I can't believe I'm saying that. This year flew by. Today's webinar will focus on criminal justice reform and health equity. My name is Lilia Mehran. I am the Health Equity Scholar in Residence at the National Urban League. I'm filling in for Lydia Isaac as moderator today. I am so excited to be joined by our two panelists, and so let me take a moment to introduce them. A veteran community organizer, Lorenzo Jones, is the co-founder and co-executive director of the Catal Center for Equity, Health, and Justice. Catal works at the municipal and state level in Connecticut and New York to build leadership and organizing capacity to end mass incarceration and the drug war. Lorenzo brings more than 25 years of experience organizing communities to influence the political process and bring about systemic change. He has developed, coached, and mentored thousands of grassroots leaders for social justice. Lorenzo has worked as an organizer, trainer, and strategist with groups across the United States and globally. He has served as an advisor and consultant to organizers and campaigns for criminal justice and drug policy reform. His leadership strategy focuses on teaching people that they can make the change they want to see and helping organizers understand the political terrain around them. Our other panelist is Anthony Collier. He is the Director of Criminal Justice at the National Urban League. He previously served as general counsel to the Dean of the Texas Senate and as general counsel to the Texas Senate Committee on Criminal Justice. He has served as legislative director for the current chair of the Texas Legislative Black Caucus. Anthony graduated from the University of Texas School of Law in Austin, serving as the student body president and the class of 2022 G. Rowley White Public Service Scholar and the 54th chairman and CEO of the National Black Law Students Association. In addition to receiving his Juris Doctorate, Anthony studied law and economics at Cairo University in Egypt as a Rotary International Global Grant Scholar and graduated magna cum laude from Texas Southern University with a BA in political science. Thank you so much, both of you, for joining us today. So let's jump right in. We know that the relationship between the criminal justice system and health equity is complex, and the interplay between health and the criminal justice system have significant consequences. So first, let's explore this relationship. The first question I have is, how do health inequities, such as inadequate services for mental health, contribute to inequities within the criminal justice system? And I welcome either of you to start.
Sure, I'll start. Well, for one, a large population of our people incarcerated are people with mental health issues. Upwards of 40% in our local jails, and I want to say around 35 to 37% in our prisons have mental health issues. And so oftentimes, instead of getting the help that these people deserve, we just place them in jail or in prison, out of sight and out of mind. And also, we see police officers often brutalizing and murdering people with mental health issues. We just saw 3 officers get indicted in San Antonio just last week for shooting a woman to death who was having a schizophrenic episode. And the officers were fired immediately because the police department said that they didn't follow proper protocol. But we understand that this happens far too often. And so instead of, for one, perhaps a police officer shouldn't even have been sent to this lady who was having the issues. It should have been a mental health professional who could have de-escalated the situation and helped this woman get the help that she needs. And so we understand that the criminal justice system is a problem, but when you have the inequities in healthcare on top of that, it exacerbates the issue. And I think the war on drugs is the perfect example of that. It's like, and I think that Mr. Lorenzo will probably talk more about that. But the war on drugs is the perfect example of weaponizing healthcare problems. Substance abuse is not a criminal issue, it's a healthcare issue. And so many people were sent to prison for decades for nonviolent drug offenses when they really just needed help, when they really just needed mental health and substance abuse care. And so yeah, it's definitely intertwined, and it's unfortunate. But I'll let Lorenzo speak now.
Thanks, Sean. As you can see, me and my router, I'm losing a fight with my router. The storm
Okay.
came yesterday through New England, and so like my router hasn't. It's like my router hasn't recovered from the rain. But bear with me. Sorry about that. No, thanks for that. Thanks for having me, you all. Like this stuff is really like one of the things as an old cantankerous organizer. As a young organizer, becoming an old cantankerous organizer, one of the things I always wanted to be was relevant. When I got, to a place where like people were doing the work differently or doing it better than me. So like shout out to like the work that we a little bit beforehand on some of the work that like Anthony, y'all doing over there that you've done across the states. So Lorenzo Jones, co-founder, co-ed, guitarcenter.org. Want to check us out. Um, I'm based in Connecticut, been an organizer since 1990, 91, been a registered lobbyist in the state of Connecticut. I've worked every legislative session every year since 1993. And I started out with like disability rights stuff when the ADA was passed and housing and steering and stuff around when the Community Reinvestment Act stuff came down the pike around redlining and stuff in the 90s. I was the broken windows organizer. And so we did the community court in Hartford in like 1996. I kind of came through that and moved into the drug policy work, but the back end of like the mainstay of my work, like throughout my entire career, has been healthcare advocacy. So everything from prescription drug coverage to immigration to cost of living.
It looks like we lost him for a second,
Yeah, seems
but
like the router continues to battle.
yeah, I hope it's not a 12-round fight.
I know the storm coming through had a big impact on internet in a lot of areas. Oh,
Well, maybe we could mute him we once we see him back on the screen, like
yeah,
his face move away. We can speak.
yeah, yeah. Um, so, oh, I see we lost him. So why don't we jump to the next question and then we can
Sure.
always go back.
Before we go to the next question, I did want to add that so the criminal justice the Substance Abuse and Mental Health Services Administration, I should say, they stated that 44% of people in jail and 37% who are in prison have a mental illness. And so, but only 18% of the general population has a mental illness. So we see that people with a mental illness are vastly overrepresented in the criminal justice system.
Yeah.
And that also takes away resources that could be used for other things. Like we're spending so much money on incarcerating these individuals. It would be much more fiscally responsible to provide the resources to get them the mental health that they need.
Mm. Mr. Jones, are you back with us?
Don't be calling me Mr. Jones, but yes. I'm sorry.
That's okay.
So I'll wrap up. So like I did a lot of healthcare stuff, prescription drug coverage, grandparents raising grandchildren, immigration, cost of living adjustment. I shifted into drug policy reform in around 2002, 2003. And the thing I'm working on is the intersection where back then it's treatment versus incarceration, but where we're arguing that drug policy reform is healthcare, except healthcare folks will only work with people with diabetes. They wouldn't work with like people who have substance use disorders until the ACA came out. So the Affordable Care Act kind of drops, and that's the first time where we kind of get some opportunity to talk about criminal justice, drug policy, healthcare, public health, harm reduction, like across the board. That rolls, of course, a decade later into COVID. And so we kind of come out with like what we call mutual aid and harm reduction, public health work. Public health work now includes criminal justice reform, ironically enough. We're making that argument, though, in the 90s. So just glad to be here today. Most recently in New York, a couple of years ago, we helped get past the parole reform bill, less is more, New York. Got a bunch of folks off of paper there, working now and supporting folks around. And it's not our campaigns, but like everybody's kind of, it's all hands on deck with closing Rikers. It's all hands on deck. Shout out to wrapping them with clean slate. So like New York is kind of like on some other like business right now, good business. So proud to be a part of that. In Connecticut, standing up a bunch of organizing around criminal justice reform stuff. We got a report that came out around mass supervision and how like super probation and parole has been used in Connecticut. While Connecticut been bragging about getting people out of prison, they pretty much just been moving them onto paper. And so we're kind of challenging that, do some work around that next year.
Mhm.
Lastly, farming, right? We've been, real quick, like we found a couple of years ago coming out of COVID, well, during COVID, this intersection between like contaminated soil and environmental racism and people who are directly impacted by the criminal justice system. And so as we talk to people who are impacted by the system directly, we found out that people who are on paper, who got felony convictions, these other things, a lot of times where we actually live is also contaminated land that nobody else wants to live on. And so we've been able to find, like through some farming organizing, working with folks across the state to increase the number of farmers in the state of Connecticut, we're able to also find people who've been directly impacted by the criminal justice system, left behind by the public health system, and like kind of like whip them up into a frenzy to kick somebody in the butt. That's me.
Thank you so much for sharing that. So, you both mentioned how, mental health services, the war on drugs, which are really, we're talking about things like substance use disorders, which really are healthcare concerns. This should be public health funding that is going towards this, but people are being funneled through the carceral system instead of getting the care that they need. And I was wondering, so we've talked a little bit about how these health inequities are leading to some of these issues. And I wonder how the opposite might be true if you think that it is. And so I wonder, what are some of the health impacts of the criminal justice system? And when I ask the question, I mean, for folks who are incarcerated, but also families in broader communities, what kind of health impacts has the system had?
Well, oftentimes when people are incarcerated and they have health issues or mental health issues, they're not getting the treatment that they need. And so they're being denied access to pivotal care and they deteriorate. And so we can see those problems exacerbate. And some people would even die in jail. Like, for example, in Texas, and this is something that the National Urban League is working on. We actually just sent a letter to the Attorney General, the Assistant Attorney General, a couple of congressional committees as well to look into this. But 66% of Texas prisons do not have AC units in all the living areas. And so, and it gets hot in Texas. I'm from Texas. I'm not sure if you all know. We had our national convention out there in Houston. It hit 108 degrees one day, right? But a lot of that is because of climate change too. But if it's 100 degrees outside and these steel and sometimes metal prisons, it can get 120, 130 degrees, and people are literally baking to death. But if you have pre-existing conditions, then these heat-related illnesses are even more severe. So a lot of the people who are dying in these prisons from heat-related illnesses had pre-existing conditions. And so in the state, well, I won't say the state, but I'll say the Texas Department of Criminal Justice will try to mask that these people are dying from heat exhaustion by saying, oh, they died from this pre-existing condition. But the pre-existing condition was worsened by the lack of air conditioning. And so, yeah, when the criminal justice system can definitely impact, the people with healthcare issues as well.
No, thanks. And Anthony, I'll get in where I fit in. So like when the question gets lobbied up, unless you want me to go first, you go ahead and say snatch it. So it's your show. I'll get it where I fit in. The yeah, right. Like this is like as somebody who's been around a long time, so you'll hear me say this a lot, just as an old like person, right? Is not old person, but like, you know, somebody who this is what I've done since I was 18 years old, right? I'm 53. Okay, right? So I ain't done nothing else. Um, it has been interesting because originally the argument for mandatory minimums, the argument for hyper enforcement, the argument for drug policy, drug war policy enforcement was the fact that so many people inside facilities, prison carceral facilities, had these other conditions. They used to call it dual diagnosis, right? They were using, they had substance use disorder, and they had mental health issues, right? This, especially when it came to like Black and brown women inside the carceral system. And so early on, it was a fight because now, since the Affordable Care Act dropped, now they say, oh, you can't pay for prison beds with healthcare money. But that's exactly what they were paying for prison beds with before the Affordable Care Act, right? So really quick, like macro big thinking thing here to kind of think about is so what we know as the drug war, we call it the drug war, right? Is actually simply just a transition of people who receive like federal funds and support and assistance being moved from the social system by welfare reform into right another system that gets then stood up, right? The prison industrial complex that then gets stood up. But that gets funded by welfare reform. Okay. So when Clinton and all the Democrats start doing welfare reform, they just move people who lived in like public housing, people who were on state assistance, city assistance, federal assistance. It just moved that assistance into prison facilities. So in the 90s, early 2000s, you heard people say, oh, I'm gonna go to jail to get my teeth fixed. Well, I'm gonna go to jail for winter, right? I'm gonna go to jail because that's where all the services are. So in Connecticut and places like that, when the Affordable Care Act passed, they literally was kicking people out of prison. And people like, hey, that's so fast. I don't have no services at home. I don't have no like anything. There's no the entire social safety net that like most Gen Xers grew up with was the prison system. But they just told us it was about deadbeat dads. It's about like, oh, Black men don't care about their community. Oh, Black women is crack like crack users and welfare queens, and these Latinos are like immigrants, like coming here to take our stuff, but they're from Puerto Rico. Make it make sense, right? It's like so we end up with like this system that moves everybody from like you go get your glasses, you go see the dentist, you go whatever services you got in a community health center in that time got moved inside facilities and people went to prison for help. That gets undone with the Affordable Care Act when the feds distinguish you can't spend that money on prison facility, on prison beds. And people fight against it. Connecticut ends up being one of the leading states to do it. They just move everybody to probation or parole. But yeah, I'll shut up. But yeah, like it's really and
Oh, I thought you were still okay.
no, I
But
saw you inhale, so I went on mute. I
oh no,
told you I'm gonna get it when I finish.
nah, man, this is your show. This is your world. I'm just living in it. But I did want to build on one thing you said, on two things actually. What he said about people not wanting to necessarily, some people not necessarily wanting to leave jail is spot on. One of my family members, God bless his soul, he got into an argument with my dad once about jail. And he told my dad, like, and I'm a first generation college student, like both, like my dad was and my stepdad were incarcerated when I was growing up. Most of my uncles, a lot of my
Oh, yeah,
cousins.
you come up out of it. Yeah. Oh
Yeah,
yeah.
yeah, for sure. But he was saying that ain't nothing wrong with jail. That's where I could get 3 meals a day, where I could get a roof over my head, when I could have a cot to sleep on. My dad was like, bro, you are sick. But some people
Don't say
get
that out loud. Right.
yeah, but it's true though.
Yes, sir.
That's where some people get help. They can get a form of healthcare that they couldn't necessarily afford out in the street. But also what you said about vilifying and demonizing Black people through the war on drugs is spot on. That's actually the origin of the war on drugs. So the President Richard Nixon, who is the
That's
author
right.
of the
That's
war
right.
on, his domestic policy chief said the Nixon campaign in 1968 and the presidency had two enemies, the anti-war left and Black people. And he's quoted as saying this: "We knew we couldn't make it illegal to be
Yes.
against the war or Black, but by getting the public to associate hippies with marijuana and Blacks with heroin, we could criminalize both heavily, disrupt those communities, and arrest their leaders and raid their homes and break up their meetings and vilify them night after night on the evening news." And this has been the playbook. The National Urban League is a nonpartisan organization, but this has
Preach. Yeah.
been the playbook of certain political leaders in a certain political party, even to this day. And
Oh,
so,
today it's called woke. Those progressives and woke. That's exactly right. Yes. Right. Yes.
absolutely. And so it's yeah. That's I'll just leave it at that.
No, so like this is it, right? Because so a quick example. When we're working on, so we're the first state to equalize the penalty between crack and powder cocaine, right? Legislatively, right? No, right. And so one of the things you never hear about in Connecticut is you never hear about, oh, Connecticut's got to go fight for something we won, but they're going to take it back. Because everything we've passed in Connecticut has been straight up legislation. So like it gets once it goes to the Secretary of State, it's harder to get rid of it than it is, right? To like pass it. So like so when we went to take on crack cocaine, we ran into this issue, right? Of healthcare being available even to people who have been convicted of a drug felony. So the way they would get you to like plea bargain is that, oh, you know what I'm saying, like people will get arrested. This was back in the day, the 90s, right? How to get arrested. He got a little hustle. He running on the corner, whatever. And it's nothing big. He just trying to buy some milk for his kids or some sneakers or go to the movies or whatever. Get his gear up, get knocked for some small package, but because of the disparity in crack and powder cocaine, like he's facing a 5-year mandatory minimum. Plus, he probably already had, it's already on paper with probation and parole, so he got to do that time he owe. Then it's some aggravated circumstance because it's in the school zone, and you sitting there trying to make $1 out of 15 cents, and like you facing 15 years mandatory. So, or you'd say you facing you're facing like 3 years, 8 years. Prosecutors say, I'll give you a plea bargain. You take a plea deal and you do 18 months, 10 years probation type of crap. And here we are, right? What's interesting about that whole like scenario is that when we took on the crack and powder cocaine fight around that, we learned this thing around how important healthcare language is. And so we kept saying treatment is better than incarceration. And people kept saying, oh, that makes sense when you say it. It's a nice bumper sticker, but it actually isn't doable based on the policy of the Department of Mental Health and Addiction Services. So why? Because treatment denotes medical. And inside of the Department of Mental Health and Addiction Services, they don't classify or see crack cocaine use as addiction. They classified it as a craving. So thousands of people are going to prison, taking plea bargains and giving up their freedom being taken from them because of an agency definition. Long story short, when we decide to act like we're going to sue their butt, they call us into the hallway and say, hey, it's when you say treatment, you denote medical. If you ask for acute care services, there's money for that. They are literally the enrollment in the access to recovery, the treatment program for people that was funded by SAMHSA and the feds. The enrollment went up 600% in one weekend, simply by changing the flyer from treatment versus incarceration to a demand for acute care services for people who use crack cocaine. It completely changed the organizing campaign. It allowed all these medical professionals, emergency room staff, nurses, doctors, harm reductionists, drug policy counselors, all these medical people were then able to come to the table around acute care services. The campaign picked up 10,000 people in a month, right? It's like, and it's the thing that you can't, and it's like between like your family having that conversation, it ain't that nuanced or that like, technical, but that's literally locking thousands of people up simply because we're not framing the question, the demand right. And we still had to override the governor's veto to pass that bill. But then we had the organizing mass to do it because we were able to kind of break that, I'm saying, that game that we're playing. Right. And so they will say, no, go to jail, get your teeth fixed, go to jail because you're homeless. I'll be home. I'll be gone till November type of thing, And no, man, like, and it's like the ACA changed that. Worker for the Urban League worked at the Urban League, but prior to the ACA, group places, agencies like the Urban League are handcuffed. Right. We couldn't get the Urban League or the NAACP or the Hispanic Health Council or any of these places to work on drug policy stuff until the ACA dropped. It literally making healthcare like the centerpiece, right, of this whole conversation, and the 10 essential benefits that got attached to that, right, and these other protections changed that entire criminal justice reform game. If it did nothing but just move all those public dollars out of funding carceral like projects and BS weed and seed drugs hot spot, all that crap, right, from the drug war. Like the ACA changes that. And then we walk right into what you were saying, brother, right? Like crisis intervention teams like become answers, and community drug courts turn to community courts where where there's a social worker, 8 social workers sitting next to the judge, not 8 not 8 sheriffs, right? So like I'll shut up. I'll talk about this stuff forever, but no, man, like, and when you talk about Texas and like, yes, like understand, y'all, like Arizona, when what was that idiot that was, oh, I shouldn't say that on y'all stuff. The dude who was the sheriff, Arpaio or whatever in Arizona, like just humiliating us people. And in Texas, when you think of a concrete building in 100-degree heat that's just beating on it and beating on it, right? It's literally like a pottery. I can't pronounce. What's it? Poly kill,
Yeah.
where you heat up a clay pot. But these are people baking to death at night in their sleep. Before we even get to that person got epilepsy, or that person got diabetes, or that person got some cancer. They got all the issues that we got, and none of the doggone respect, access to, services or protections that we have. Because the Constitution says that they're slaves. Period. They are enslaved people. So I'm gonna shut up. I'll get ranting on this. It seemed like a long way away from Albany and the $1 million staircase in Albany. It is not. It is not. And I feel like the ACA, the Affordable Care Act and Affordable Care and Patient Protection Act, it literally changed that game. It's like literally defunded prisons. Nobody says it like that, but it's what it did. And it made the criminal justice, it took drug policy and criminal justice and forced the philanthropic world to work on those two things together. There was a time when the Soros Foundation kept those things separate. Oh, that's drug policy, or that's sentencing reform, or that's criminal justice reform for their funding purposes. The ACA forced the funders even to say, no, this is one deal. And then we drop COVID on top of it. After that, we end up with a thing called harm reduction, mutual aid, public health, blah, blah, blah.
Anthony,
I'm gonna shut up.
Oh, no, I love everything that you're saying, and I so appreciate your perspective. Anthony, do you have anything else you'd like to add for that? I know we have other questions, but for that piece.
Sure. Yeah, man, he said a lot, and I appreciate it. For one, I want to add, when he said that Texas is not too far from Albany, Dr. King said injustice anywhere is a threat to justice everywhere. And also, when he was talking about the response as far as like the crack epidemic and saying it's calling it instead of an addiction, they were calling it a craving. You just look at the response to the opioid crisis versus the crack epidemic, and we understand why they met the crack epidemic with an iron fist, with tough on crimes, including President Joe Biden, who I'm still voting for, but he was the author of the 94.
Zero. Oh,
And and of course President Clinton, who championed it and signed it into law. But because like what Nixon did back in '68, right? They took that blueprint, not just Republicans, but also I'll say conservatives, because it was conservative Democrats and conservative Republicans. They took that blueprint and they associated the crack epidemic with Black people, even though we understand medically cocaine and crack is essentially the same thing. It's just crack is a more accessible which means poor people can afford it. So those disparities were deep in racism. But when we have the opioid crisis, they see themselves in that, because they see middle America, they see their kids and their housewives with this mental health crisis. Both were health issues, but I think the opioid crisis goes to show what should have been done for the crack epidemic.
And
can I
so
say a
both of
quick
you,
thing on there
sure.
about the opioid? To that point, Anthony, right? So I was born in the south side of Chicago. You probably tell I'm not from Connecticut originally, okay? I was born in the south side of Chicago. I just got back from Chicago where I'm sick now. In rural Illinois, outside of Chicago, most of Illinois is rural. To your point around the opiate stuff, there is this other little sliver, right, of like poor white folks that they didn't thrown away too, right? In places like rural Illinois, when we start talking about things like Good Samaritan, and we're going to get into healthcare and criminal justice reform and where those things really lock up locally, all politics are local. Good Samaritan work around like protecting people around overdoses. In rural Illinois, they was getting mothers, white, poor, rural mothers, jail time, prison time, because their kids overdose, right? So like all white folks ain't escaped this opioid thing. They still got that work for, like, you know what I'm saying, the ones that ain't the ones that they love. And like they don't love us either. So like we should go find them and get up with them. Yeah.
Yeah, and so Good Samaritan laws, that's a great point. Good Samaritan laws are basically, if you call 911 for an overdose, you'll get immunity, so they won't be able to use evidence around you to prosecute you for a later crime. And I worked on harm reduction, and I actually published a harm reduction paper when I was in law school. There's an organization called the Texas Harm Reduction Alliance that y'all should check out. But basically, so in New York, I believe they have the Good Samaritan
Oh
immunity.
yes.
Uh-huh.
Oh yes.
Not every state does. So Arizona doesn't, Idaho doesn't, Iowa, Kansas, Maine, Missouri, Oklahoma, South Carolina, Texas, and Wyoming. These are states that do not have that Good Samaritan immunity. So if your friend is overdosing and you call 911 and they come and see y'all are doing these drugs together, they can actually prosecute you, which discourages people from calling 911, and it causes people to overdose where those are lives that could have been saved. So this is like common sense reform. And if you're in one of these states, definitely reach out to me. I would love to connect with you so we can work together to get these laws passed.
You've both touched on policy and
Yes.
legislation. And so the Good Samaritan law is one, I'm learning from this conversation too. Are there other policies or legislative actions recently that you think are really important to, for both of these pieces, to promote health equity and also towards criminal justice reform, that work in tandem? And are there any in the pipeline that you'd like us to keep an eye on?
Yes. So I'll start with the pipeline. So Senator Cory Booker and Senator Raphael Warnock, which is one of my favorite people on this planet, they introduced the Health Equity and Accountability Act, which would reduce racial and ethnic health inequities, and it would address the maternal mortality crisis, because we know, especially with Black women, we're losing a lot of our babies. It would strengthen health data collection and research. It would expand access to mental health care, target gun violence, improve language access barriers, and it would diversify our healthcare workforce, which is essential because oftentimes, especially for our Black women, when our sisters go to the doctor and they say they're in pain, the nurses and the doctors don't take them seriously. They don't believe them, and then they end up dying from this complication. Whereas had it have been a Black doctor or a Black nurse, it would have been more likely for them to take that person serious. And this is not an indictment against anyone, right? Because there are great doctors of all race, colored, and creed, but we just know that more representation would equal more lives being saved. And so this is essential legislation that we definitely need to get passed. It will build on the work of the Affordable Care Act. Now, as far as other legislation, like in addition to the Good Samaritan laws, there are other harm reduction laws out there, like syringe service programs. There's and I believe Lorenzo could talk more about that, but syringe service program. So basically, and I think in New York, if you're in New York, most of this stuff you have, like, so don't take it for granted that you know y'all have some pretty good harm reduction policies, but in a lot of states they don't have that, so where you can go and get a clean syringe in New York, but in another state you could be prosecuted for that because you have drug paraphernalia.
Yeah, no, I was gonna. That's what. Yeah, exactly like the group. I would say tell anybody you probably have in your network somebody. I want to mention. I don't want to mention this like diversion program lead, as well as another thing that's out there. But look for a group called Vocal. Right? If you haven't heard about them, that's the group. That's one of many groups. It's just the one I'm probably most familiar with and got a longest history with. So I don't want to like I ain't disparaging nobody else that's out in these streets. So don't play me. But vocal, I know vocal stuff, and I know from Kentucky to Albany to they're everywhere in some form of fashion. Even if they don't have a chapter there, they definitely will know who the harm reduction people are in that area. I would suggest we have a practice in organizing called one-on-ones, right? And it don't have to be a one-on-one. It's a small meeting with somebody where you're meeting with them just to learn about them. What I would suggest to people, they used to call them relational meetings. People in Rochester will know them as like relational meetings in the 70s, right? Um, um, I would suggest that people find the harm reduction people in your area. And if you don't know who the harm reduction people are in your area, reach out to like the vocal folks and they'll put you up on who that person is in your area if it's not them. Um, but do a one-on-one with those folks and ask these questions. Syringe exchange programs, right? Safe injection facility work, Good Samaritan like proposals and policies, and like what are the harm reduction folks doing in that area, like in your state or in your city or municipality. Some of this stuff is really intimate, so there's these where you're going to find the most effective harm reduction is going to be with the harm reduction person that's in your municipality. They're going to have a direct relationship to the public health folks in a different way, right? And so that would be to me, it would be the easiest way and probably the most effective way to actually also build that kind of like those new lines of communication. If you don't got them, if you do got them, go get them, go get better at it, right? To Anthony's point. Um, so safe injection facilities is what they were syringe. They used to call it like syringe exchange of clean needles, but now a lot of harm reduction places straight up are giving out like fentanyl strips. Right, they got fentanyl test strips so people can test their stuff. At Qatar, we have a project called Justice Not Harm, where we put together care packages based on the needs of the group that we're partnering with to do the care packages, right? So if we're partnering with a church, that care package might have the stuff that the church has identified the people who they're serving need, and we kind of help round those things out with some other things that maybe the church wouldn't get or that harm reduction spot won't have, like fentanyl test strips. We might just pay for them straight up and have them mailed to the harm reduction. So anywhere, when you meet the harm reduction folks here, find out what's the thing that they need. Last thing, there's a project, I'm not sure where it is now. We were part of some of the original national version of it, but the law enforcement assisted diversion program. Whether you in Atlanta or you in New York, that stuff is playing out differently based on all politics are local. But it's a network to figure out like what are they doing, who are they working with, and if they're in your area and they're doing something you don't like, you should go check it. But if they're more than likely they're probably doing something that you're trying to do, and they probably got an on ramp for your people to find locally, right, to get engaged and get informed about this. So the National Lead Support Bureau, the Drug Policy Alliance, definitely. If you're not talking to them, you're not talking to the people to talk to. Just to keep it a buck. They're based out of New York. Cassandra Farik is the head of that. Like, hit her up, and she can put you in touch with this. Her staff gonna have all these other networks available. So probably worth the combo with them. I mean, like Anthony and probably know all them people. Yeah.
Yeah, so that's spot on. And so, like he mentioned, the syringe exchange programs, people, if it's illegal in their state, that they might be exchanging dirty syringes, which can cause a number of problems, including, the sexually transmitted diseases and other things, right? And he also mentioned the fentanyl detecting strips. And this is critical because oftentimes people who overdose on fentanyl didn't even know they were taking fentanyl, right? Because people are cutting the drugs and placing fentanyl in it and then you take it and you die. So if you have these fentanyl detecting strips, you can see how much fentanyl is in there, or if there's any fentanyl in there at all, you can make a more informed choice. And then also naloxone administration, which will help prevent people from overdosing. So these are the type of policies that you should be looking for. And if it's not in your state, that we should be advocating for.
You've touched on policies, and also Lorenzo, you mentioned some really wonderful programs like Vocal. And I was wondering if there are other programs that you're aware of that have had success in addressing some of these inequities that we've been talking about. And feel free to highlight the work of that you're doing also here.
The work I'm doing on this stuff is with the people that are doing the work. So don't try to get me out here in trouble. Like, no, so like there are people who've been doing harm reduction work before it was chic. Real talk, needle exchange in alleys on Skid Row in Chicago, back when you could get real prison time for having clean needles, and you was even if you was a diabetic, you literally had to have a diabetic card back in the day to say you were a diabetic, which is why you had syringes or you were going to prison. People going to prison for carrying more than one condom in their pocket for sex work. You see what I'm saying? Like New York, stop and frisk. We talk about, oh, stop and frisk and stuff. We don't talk about the harassment of like the needle exchange van in Bridgeport, Connecticut by the police, even though we passed a law to protect them, right? So one of the things, the good thing about this, I'm just back up. One of the other places that we've found now to be a lot more amenable to this conversation is straight up going at the State Department of Mental Health and Addiction Services, or whatever yours is called, that does that. Because because of COVID, because of a bunch of harm reduction and mutual aid work overall, a lot of staff in those departments have come out of this work. So a bunch of the old fogies, the old Archie Bunker types, like, are either in these director positions or disconnected, they on some commission. The actual people who are grinding this every day as a 40-hour-a-week job, those folks actually probably have a much more loving respect for this kind of work. And it's probably worth a series of meetings with them. If they don't, they need a little act right. Give them a little act right, they'll be okay in a couple of months, right? Last quick answer to that is political power is organizing, organize, organize, organize. If you're not organizing, like, you're dying. Kind of how it works, right? It's a living thing. So public education around this, right? You hear Anthony is walking through reports, he's walking through language that are talking points. So it's like Urban League has a bunch of this stuff like already synthesized up. They got staff across the country that's been like in this thing for the last decade, right? Most of the people like Anthony in this work, it's like the old people came out of like Katrina in in New Orleans, right? And the Jenna 6 hanging tree. You know what I'm saying? Like these kind of things. So like those people are now in positions, right, inside these administrations in some cases that actually are allies if we can figure out how to make it safe politically for them to work with us. So we got to organize the political cover for our allies inside the system to be able to work with us. If we don't organize the political cover for them, they're going to tell us, hey, can't do that. Legislators, elected folks will say, I can't do it. So organize, 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 do your one-on-ones, get your talking points up, get your like, everybody get on the same page. There's 3 talking points that we all are using type of thing. Talk about whatever you want to talk about, but you're going to hit these 3 kind of thing, that type of discipline. And yeah, like, go find somebody but to kick. They out there.
Anthony, do you have any other thoughts you'd like to share on that topic?
Yeah, I think that, the Texas Harm Reduction Alliance is doing some good work. I also think so. Also, the Mayor Sylvester Turner, he's the mayor of Houston and the Houston City Council. They recently allocated $5 million to relocate people who are in a cancer cluster. And so I appreciate them for doing some of the work to try to help. It's unfortunate that people have to be relocated and uprooted from a historic Black community from no fault of their own. So I'm from Manor, Texas. But I was born in Houston on the northeast side of Houston in Cashmere Gardens, and this is called a cancer cluster. If you haven't heard of that, it's actually a medical term. It's a cancer cluster that in Fifth Ward in Houston. These are historically Black areas in Houston, Texas. And then what happened was there's a railroad company called Union Pacific who for years was dumping chemicals into the soil. And Lorenzo talked about this earlier. It hit close to home when he was talking about the polluted areas that a lot of us live in, right? And where there's also a high criminal justice impacted folks. And so they were dumping that in the soil for years, and it was causing so many people to die from cancer, and they just recently caught it. But my mom is a breast cancer survivor. Her sister, my aunt, is a breast cancer survivor. My uncle died from cancer, and I have a cousin who died from cancer. So it's I literally lived this, and so I'm thankful that my mom moved me out to the country when I was young, and that I didn't end up being impacted by cancer. But so I just wanted to also uplift that Mayor Sylvester Turner and the city council are working to try to remedy that, and also we've gotten the federal government involved as well, to see what type of remedies we can have and how we can hold Union Pacific accountable to deter other corporations from polluting vulnerable communities. So, when we talk about the intersection between criminal justice and health equities, right? I think this is an intersection as well because what they did to us was criminal, and they need to be held responsible for what they did.
Oh, tag me in because as soon as we caught soon as we made the connection, as soon as we made the connection to, oh, welfare, what we know as the drug war really isn't the drug war, it's the implementation of welfare reform. It's the implementation of immigration reform. Opiate, you know what I'm saying, like policy in these other countries, like, right? Like in Colombia, right? Where they were poisoning the farmlands and paying farmers to grow other stuff besides cocoa leaves. Big like Noriega stuff. I know that seemed like a long way away, but when you sitting in a goddamn when you're sitting in the doggone, you know what I'm saying, prison, baking to death, it ain't that big of a jump for you to make that connection, you know? And I wanted the thing that you touched on, like, it's so important that you said, you named it, it's so important. Like, get into these mayoral offices, not these mayoral campaigns. I know Urban League, y'all always trying to find somebody, run for office, do something, like get elected, something. God bless you. Everybody can't run for office. So everybody who ain't running for office, pick somebody who is in office's butt about this. Like it is. I can't say this enough, and I'll stop here saying it, but I can't repeat it enough. Where it's like the point you're making, like understand your local like dynamics inside your city hall, is your mayor an ally or just somebody you like to vote for because he's cool or she's cool or they're cool or whatever pronoun they're using today, whatever, right? Got it. Love it, good. But like, find out who these people are. Don't just read their social media page. Don't just read their press release. Go sit with these people face to face. Ask them some questions that you want answers to, that you got expectations for. You'll see in the write-up in my bio. I'm a firm believer in turning community people's opinions into public policy. If we keep that as a due north like direction, we land on a star headed to the moon. C.S. Lewis. You know what I'm saying? Right? And so I'll stop, but it's like that is so important to grow. This thing, it's like, yeah, state capital. Yeah, I forgot the group I was going to name was the ACLU. Actually has a ton, especially in Texas. What's my man name? I can't remember his freaking name to save my life. Is the like OG, triple OG, double triple OG, out of Texas, ACLU. I just had it and lost it again. He's still around. Find the harm, call the ACLU in Texas, ask for the OG harm reduction dude. I think he white too, so they'll know who he is. Okay, right? But there's a Mark in Hartford. What's Mark's last name? The Greater Hartford Harm Reduction Coalition, now the statewide, no, I'm saying coalition, hit those folks up. And then those folks are going to know Lisa Ray Valley in Colorado, right? Harm reduction. And so like we can get some of these names back to you later, but like do some homework here and walk into these like local, like political offices informed and send these political people back informed. I promise I'll stop here. A rule we have for meeting with elected people is that when you meet with them, you tell them, when we leave this meeting, we will tell people what you said. It is completely up to you what we tell them. Proceed, right? If you do that every time, you'll get accountability from these folks. And like you'll get people in the community who will trust your meetings with them. And thus they'll trust your strategic direction, even if they feel like they got to challenge it. So I'll stop. But like, yeah, get into these local offices and find out who these people are, what they believe and what they don't believe. Do not trust social media and Google. Those are all press releases.
So it looks like we're winding down on the hour, and I want to give you each some time to share final thoughts, if there are any takeaways you want to make sure folks leave with, any recommendations. And Anthony, let's start with you.
Sure, I think I shared it. I just want to thank everybody for being here, for taking the time out to attend this panel, and for caring enough, to get involved, to get informed. You can add me on LinkedIn. You can send me an email, Collier@nul.org. That's national. That's A as in Anthony, Collier, Collier @nul.org. If you want to get involved, if you want to get active, if there are some harm reduction legislation that you want to see implemented in your community, feel free to reach out.
Thank you, Anthony. Lorenzo?
Do not call me. Do not call me. I know what's gonna happen. Oh, Lorenzo, can we get no, we can't get on the phone. No, I'm around. Like, hit me up if you want to talk some more junk. Thank you for having me. I love, as you could probably tell, I love these kind of sessions. And like, yeah, like if I had a piece of advice to leave you with, it's that like if I learned anything about this work, is that like people in communities always figure it out. When you see a coalition fall apart and you see like these like collaborative campaign kind of everybody gotta get along and everybody gotta be using the same communication consultant and we gotta have a communication strategy. That's crap. That's a cult. That's not movement building. That's cult building. It's fun. That's funder driven crap, right? And sometimes we can't avoid that because it kind of like if you were a carpenter, it's like getting splinters. It come with the job. But just my advice is like be as conscious of that And the way that you kind of like vet that kind of stuff is that like have a legitimate base in your communities. It's why I'm gonna stay on this horse, Anthony, of like get into your mayoral office, get into your city manager's office, understand the charter of your municipality, understand like how the votes work on city council, understand how like these committees work at the state capitol. That stuff is not lobbyist sellout stuff. That's called being informed and getting girded up. Right? Get girded up. Go ahead.
No, I was gonna say something unrelated, so you please finish.
I want to double down on like what you're saying. Thank y'all for having me. And don't call me for coaching stuff. I don't got no time to be talking junk. No, call me. I'll throw it back to you. Thank y'all for having me. This was awesome. And yeah, like get into those local offices, get into these local like agencies that's doing this work for real. Don't try to copy them. Find an on ramp and go help them do something. Go shadow some harm reduction. It's just for your own edification. Study to show that self a workman without shame unto God type thing. You see what I'm saying? I'll throw it back to you.
Yeah, I was just gonna also shout out Dr. Edian, who's in the chat or who's on the call. He's phenomenal in his own right. He's also a professor, and I think that he could have easily led this discussion. It would be cool. We can invite him if we could get him if his schedule permits. So shout out to him. Thank you for being here in attendance.
Thank you. Thank you both so much. I'm so sad that we're out of time. I would love to continue this conversation, and I really appreciate your insight and your passion. And thank you to everyone who attended for taking some time out of your day to be here. The webinar series will continue in 2024. We'll be in touch soon with more information. And in the interim, I wish you all very happy holidays, and I hope you have a great start to the new year. So please take care and be well. Bye-bye now.